Hi, I'm Dr. Michael Taggart with Lake Washington Chiropractic. I'm a board-certified chiropractic physician with over 18 years clinical experience. I have advanced training in neurology, spinal rehabilitation, and metabolic and nutritional testing and treatment. I want to welcome you to our Thyroid Recovery Program DVD, where we explain how we treat our patients both neurologically and metabolically, and we explain how this is going to help you with your chronic thyroid condition. The information I'll be sharing with you is somewhat technical in nature, so I recommend that you maybe watch this DVD more than once to help you understand the concepts. Also, it would be a good idea to take some notes throughout the presentation. There's a website that I'm going to bring your attention to. It's called www.lifechangingcare.com, lifechangingcare.com, all one word. I'd like you to go to that website and click on the testimonial section and spend some time reading about the testimonials of patients who have been helped with the kind of therapy that I do and other doctors throughout the country who have been trained in a similar manner to myself. There's a section specifically on the thyroid. There's also testimonials from patients who have been helped with all kinds of chronic health conditions like fibromyalgia, chronic neck and back pain, peripheral neuropathy, migraine headaches. And so as you watch these videos, it's going to help you have some hope that if these people, many of which were told there was nothing more they can do and they would just have to suffer and be on medications for the rest of their life. So if these patients can get better, then that's going to give you some hope that you can get better too. Now, a lot of the information I'll be sharing with you today is based on this book called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? And this is by a Dr. Karazian. He is one of the foremost authorities in our country and probably even the world on thyroid disorders and effective treatment. I would highly recommend that you get this book. You can go online and get this book through Amazon or any type of similar type of online bookstore. If you become a patient or office and we accept you into our program, you'll get a complimentary copy of this. You'll very much enjoy this book. Now, 99% of this information I want you to know you've never heard before. And we want to talk about why thyroid health is so important. Now, a big concept to understand is that every cell in your body has a receptor site for a thyroid hormone. So if there's a problem with thyroid metabolism, that could virtually affect any system of your body. Let's talk about some of the systems that can be affected when your thyroid metabolism is not functioning properly. Well, it can definitely affect your level of energy. If you have a low thyroid, you're going to be very lethargic and you're not going to have any energy. If you have a high thyroid, you're going to be kind of jittery and bouncing all over the place and feel like you're hyperactive. The thyroid also is important with bone metabolism. There's a hormone called calcitonin that your thyroid, in conjunction with your parathyroid, helps to balance calcium levels in your body. So if you have a chronic thyroid condition, you may end up with weak bones or osteoporosis. Low thyroid function can also affect your gastrointestinal function. If the thyroid's low, the colon, the bowels become sluggish. That's going to increase the time that it takes you to digest your food, which is going to expose you to more toxins than you should be exposed to. It's going to increase the possibility of food intolerances and also developing gut infections. Low thyroid also affects hydrochloric acid production. So if you're not digesting protein, that can also set you up for a lot of digestive issues. It also has a big effect on your hormones, both male and female hormones. If a woman has a very low thyroid, she will not be able to ovulate and won't be able to conceive. Thyroid imbalances, especially low thyroid, can also affect your detoxification mechanism, like your liver and your gallbladder. Those become sluggish. It decreases your ability to detox your body. And also, we often find that patients who have a low thyroid will often have high cholesterol and high triglycerides. When the thyroid is brought back into proper function, these blood lipid panels become normal. Now, another thing that can happen when you have a low thyroid is that you can't burn fat. So as a result of that, you don't lose weight, despite diet and exercise, and that can be very frustrating for people. It also can impair your ability to metabolize glucose. Glucose and oxygen are the fuel that your brain needs. So if you're not getting proper glucose metabolism occurring in your body, you're going to have very poor mental function, and you're going to have brain fog. The thyroid also has a big effect on body temperature. So if you have a thyroid problem, it could contribute to hot flashes and night sweats. Also, low thyroid can also affect anemia, because if you're not digesting proteins, you're not going to be absorbing vitamin B9, which is folic acid, vitamin B12, also called cyanocobalamin, and it's also going to affect iron absorption. So this is something that thyroid problems can also cause. Thyroid problems can also cause heart problems. There's a protein breakdown product called homocysteine that your body makes. And if that level raises, it actually inhibits your thyroid. And if your thyroid is either low or high, it can cause a low pulse, a sluggish heartbeat, or if it's a high thyroid, it can cause a rapid high heartbeat and rapid pulse. Now let's talk about the current medical model for thyroid diagnosis and treatment. Unfortunately, the current medical model is based on 1960s physiology. Now this presentation that you'll see will help you understand why this approach is totally inadequate. And that's why many patients are not improving who have thyroid problems. The information I'll be presenting is based on 2010 information. Now, if you're watching this video, it's a good chance that you've had medical care, maybe several medical people that you've seen, and the fact that you're watching this means you haven't gotten better, and so you're going to have to look at a different approach if you want to recover. And this DVD is going to teach you exactly what you need to do to get your life back. Now, there are 7 different metabolic pathways in the body, so this would be something good that you'd want to start making some notes about. We'll go over each pathway. Now, here's the thing that's really surprising to people, is that only one of these pathways is really a fault of the gland itself. The rest of the problems are something else going on in the body that's affecting the thyroid gland. So let's talk about some symptoms. Actually, let's talk about thyroid metabolism so you can understand a little bit about how the gland works. So here's what happens. There's a gland in your brain called the hypothalamus. And the hypothalamus senses the level of thyroid hormone in the bloodstream. If this gets low or high, the hypothalamus is going to respond to that. If the level of thyroid hormone is low, the hypothalamus is going to send a neurological signal and a chemical signal to the pituitary gland. The chemical signal is called thyroid releasing hormone. Now, if that pituitary is functioning properly, it will respond to that stimulus, and it will also send another neurological and a chemical stimulus to the thyroid gland. This stimulus is in the form of what we call TSH. You may have heard of this, thyroid stimulating hormone. The pituitary makes it. When the pituitary makes it, it's trying to tell the thyroid gland that it's time to make more thyroid hormone. So when this stimulus occurs, the thyroid makes a protein called thyroglobulin. It combines it with an enzyme called thyroid peroxidase, and then it also combines either 3 or 4 molecules of iodine, and it makes what we call T3 and T4. Now this is very important. Once the thyroid gland makes those 2 hormones, only T3 is the active form. T3 is what creates the activity in the cells. T4 is inactive. It doesn't have any real strong physiologic function. Now, your thyroid gland, when it makes these hormones, only 7% of it is T3. So if this is the active form and only 7% is made by the thyroid, and the body relies on the rest, other tissues, converting it to T3, and if that's not converting, then we have a real problem. 93% of T4 is going to be converted in the liver to the active form of T3. Now, of that conversion in the liver, 20% is what we call reverse T3. It's not active. It doesn't have any physiological function. Now, of the component that is not converted by the liver, that will catch a ride with something called TPG, or thyroglobulin binding hormone, and that will actually go into your muscles and your nerves, and the peripheral of the tissues of the body will convert that into T3. Now, another 20% will also be converted in the gut to the active form of T3. So if we have a liver problem or a gut problem, then we're not going to get that conversion, and you can see how this would be a huge problem. Now, here's the thing that's very important to understand. If your doctor that you've been seeing for your thyroid has not thoroughly checked your liver or thoroughly checked your gut, then you have not had a proper workup, and it may be one of the reasons that you're not improving. Now, a lot of people come to my office saying, well, I've had the blood test, the doctor says they're all normal. This happens like over and over again. So there's two